I have a beautiful blonde hair, blue-eyed 9-year-old daughter who is a quirky little girl, contagious laugh, funny, avid reader, and she was a blooming artist and an athlete, and she's no longer with me anymore. She died of medical errors. She got a hospital-acquired infection. She was a classic case of failure to rescue, where all the signs were there and that she was deteriorating and no one did anything. She was in a teaching institution where the fear of hierarchy was there and the resident didn't go up the chain of command. The organization where she died shut down on me. They wouldn't talk about what happened. They would not give me her medical records. It took the organization where she died 3 years, 7 months, and 28 days to have a conversation with me.
Traditionally, when harm has occurred, the first reaction is to deny responsibility and defend vigorously.
When we talk about deny and defend, we talk about a whole paradigm of responding to patient injuries or unanticipated clinical outcomes that has historically, and literally for decades now, been given over to the legal profession.
Culturally, we have several generations of physicians now who believe in patient autonomy and who believe in things like informed consent. If one should, and under law must, tell a patient about the risks of what might happen to them, don't you think we should tell patients about what actually did happen to them?
Communication and Optimal Resolution Process, or Candor.
The Candor process is a simple plan, and hospitals should have it ready to go whenever a patient is harmed during a stay.
The only way for an organization to learn is to show the failures and say, we are fallible, but we're going to learn about this, we're going to tell you about it, so that all of us together can make the system better.
The implementation of these programs requires culture change. It requires a change in how people within the hospital identify errors, communicate errors.
Start small, build confidence and build expertise in this space. The real truth is that this approach taps such basic human needs that it works in Tokyo, it works in London, it works in Stockholm, and it will work everywhere in this country. Just don't be afraid.